Avoid unnecessary surgery. This Good Morning Washington Spotlight on Your Health is sponsored by Regenerative Orthopedics and Sports Medicine.
Well, if you or someone you love is in pain, it's important to know all of your options before surgery. And that's why we're putting a spotlight on Regenerative Orthopedics and Sports Medicine, the practice that's helping patients across the DMV avoid surgery.
And we have a very special guest with us, Dr. John Ferrell, co-founder and managing partner of ROSM. It is great to have you here with us on the big yellow couch. I want to start by talking about what is Regenerative Orthopedics and kind of how you work with all major insurance companies.
Well, first of all, thanks for having us here.
Yeah.
Well, when we talk about regenerative orthopedics, we're essentially talking about a relatively new field of medicine. So regenerative medicine is where people take their own cells to try to heal themselves. And so the body's trying to naturally heal itself. And when we're taking that and using that in the orthopedic realm, we're doing that for, chronic issues in shoulders, knees, hips, in order to get people out of pain, increase their range of motion, increase their function. Yeah, so when we talk about regenerative medicine, there's usually kind of three things that we're classically talking about. We're talking about prolotherapy, which is an injection of dextrose or sugar to stimulate healing and repairing of, chronic tendon issues or ligament issues. We also can talk about platelet-rich plasma, which is where we take your own blood, we centrifuge it down in order to get rid of the red and white blood cells, but keep the platelets and keep the plasma in order to inject into areas of pathology. And then we can also get mesenchymal stem cells out of your bone marrow or out of your fat in order to treat kind of larger issues.
Wow, so you guys really are at the forefront of all of these new treatments and technologies. And I know that you guys really try to avoid surgery, but I'm sure, is that sometimes something that you have to do with patients?
Yeah, no, we work really well with a lot of our surgery counterparts. We find that there's definitely a lot of things that need surgery. If somebody comes in with a fracture or a broken bone, they're going to definitely need surgery. Or if somebody has a large rotator cuff tear that's completely separated from the bone, there's no injection that I can do to get that better. So we have a really good relationship with a lot of our surgeons that we work with. And then we also, encourage our patients, if they have any second thoughts, go get a second opinion for a surgeon. Evaluate and see what the surgery would look like, and if that's something you want to go forward with, great. If not, you can come back and we can try some other non-surgical options.
Well, I think we've talked about that before with you, that, people think if I'm in pain, I've got a shoulder that's in pain, surgery is the only option. That's why I come in and talk. It may not always be, and you're finding ways at ROSM with new techniques to decrease pain. How do you educate all of your patients about those new techniques?
Yeah, when we look at, the Latin root word for doctor, it actually means teacher. And all of the doctors that we hire, they're all teachers. They really want to make sure that the patients are well educated and they can make an educated decision. And so we have great information on our website that talks about the different treatment options. We also have a lot of research on our website. So it actually gives you the actual research articles that show if you're using PRP on a rotator cuff or for knee osteoarthritis. And then we have a great YouTube page that has a lot of our doctors with videos talking about injuries, talking about different treatment options, so we can educate patients and make sure they can make an informed decision.
Knowledge is power, and it is so empowering as a patient to be able to kind of do that research before and then come and ask questions. Let's talk about some of the patient success stories, because there's probably nothing better than somebody coming in pain and then realizing that there are other treatments aside from surgery, and then they're no longer in pain anymore.
Yeah. So if we talk about patient success stories, I probably have two that kind of come to mind. One is a 50-some-year-old male who had horrible knee osteoarthritis in both knees. And, it was really starting to affect his daily life. He couldn't play with his kids. He was, affecting his mood also because he was in pain all the time. And we were able to take his own fat and treat both of the knees with his own fat. And he had significant reduction in his pain. He was able to lose about 30 to 40 pounds. And he was able to be a lot more active with his kids. And this was over 4 years ago. And so I still see him on a pretty regular basis. Every time I see him, he thanks me so much for kind of giving his life back. And so, that's not promised for everybody, but, this is kind of one example of, a really successful. And then another one that was really successful is actually a patient that I'm going to write up for a case study for a research article. So she had a full thickness rotator cuff tear that was not retracted, meaning wasn't separated. We took fat out and injected into that rotator cuff tear. Not only did she get improvement in pain, range of motion, and function, but when we repeated that MRI, it actually showed healing 12 months later. So this is one that, you know, I think is one of the first times we've seen that in the literature, so we're going to publish that, and that should be an exciting one to publish.
Incredible. And I know there's people watching at home that have maybe gone to the doctor that's been told, hey, the only option is this and surgery, and that may be something that's scary to them. Who would be perfect for an evaluation and to come into ROSM?
Yeah, so I think that people who have tried conservative care, physical therapy, chiropractor, they've had injections and just haven't been successful, or people who are looking for, you know, it's not quite bad enough to have surgery, those are the people that we say are kind of in that treatment gap. And those are perfect patients for us to kind of come and see, evaluate. You know, we take all major insurances, so an ultrasound exam, that's going to be covered. You know, we can talk about the different treatment options, and you can make a decision to see if that makes sense for yourself. And then the other group, I think, is really our weekend warriors. Those people that want to go out there, that are waking up every morning at 6 a.m. to go to the gym, that want to go to play basketball with their son on the weekend.
We're talking about somebody that we know.
You know, these are people that you know, they want to do whatever they can to stay active, and we're going to be able to keep them active.
Yeah.
Well, and the great thing is you guys have locations all across the DMV. For our viewers that want to connect with you, what's the best way to go about doing that?
Yeah, if you go to our website, rosm.org, there's a contact page. You can see a list of all of our different locations, and someone will get back to you immediately to kind of schedule an appointment.
Thanks so much for joining us.
Thank you.
Always
Oh my
great
gosh,
to
thank you
see
for having me.
Appreciate
Such great
it.
information.